Every idea has been put on the table. Every argument has been made.
To an audience of doctors and nurses, the president said the differences between the parties are simply too wide to bridge, and he firmly rejected Republican calls to scrap his plan and start over.
Insurance companies aren't starting over. They're continuing to raise premiums and deny coverage as we speak.
Listing key elements of his bill, the president put cracking down on insurance companies first.
No longer would they be able to deny your coverage because of a pre-existing condition. No longer would they be able to drop your coverage because you got sick.
The president's plan would also extend coverage to about 30 million uninsured, about 15 million by expanding Medicaid. Millions of others would be required to buy insurance or face a fine. Lower-income families would get subsidies to help pay for it. At $1 trillion over 10 years, the plan would be paid for primarily by tax increases on families making more than $250,000 a year and $500 billion in cuts from Medicare. The president did add a few minor Republican proposals from last week's bipartisan summit, such as the use of undercover investigators to root out Medicare and Medicaid fraud and expansion of health savings accounts, which allow for tax-free savings to pay for medical expenses. But with Republicans still unanimously opposed, the president left no doubt. He wants Democrats in Congress to pass his bill with Democratic votes only, using special procedures to override Republican opposition.
I believe the United States Congress owes the American people a final vote on health care reform.
The president said he wants the bill on his desk in the next few weeks. The vote is expected to be close, but the tide in Congress may be turning in the president's favor.
As hard as it is to vote for an unpopular bill, it is even harder for Democrats to go to the voters in November and have nothing to show for their efforts.
They're making a vigorous effort to try to jam this down the throats of the American people who don't want it.
But Republicans say Democrats are digging their own political grave if they pass a bill that raises taxes, cuts Medicare, and could add to the crushing national debt.
Every election in America this fall will be a referendum on this issue. And there's an overwhelming likelihood that every Republican candidate will be campaigning to repeal it.
The president says he doesn't know how this is all going to play out politically. He wants to pass health care reform because, quote, it's the right thing to do. So does he have the votes? The White House says he will, but the truth is it is a very fluid situation. Katie?
Chip Reid at the White House. Chip, thank you. Bob Schieffer is CBS News chief Washington correspondent and anchor of Face the Nation. Bob, Chip says the White House is pretty confident the votes are there in the House. Is their confidence well-founded in your view?
Well, Republicans are not going to vote for this. They think that the American people don't want it. The president is going to have to get Democratic votes. The House leaders say they can get those votes for him by the time this comes to a vote. But as of tonight, Katie, as of right now, they do not have the votes.
Meanwhile, Bob, in 2007, when President Obama was a senator, he criticized the use of the reconciliation process in health care reform. Is this a case of where you stand depends on where you sit?
I guess it does, because the people, the out party, is always against reconciliation, and the one that has the majority always thinks it's the right way to go. The president was in the minority then, and now he knows Democrats are in the majority.
All right. Bob Schieffer in Washington. Bob, thanks so much.